Okay, so GLP-1 medications like Ozempic and Wegovy are now in mounting legal battles over potential vision loss and blindness, which is a really big deal, right? It's not like just a side effect of having a rash. No, it's you've permanently lost vision because of this. But the big question is, what is the true risk, right? If you're taking this, is this something that could actually happen to you? So in today's video, we're going to break down not only what the updated science says about that risk, who is most vulnerable and should be paying attention and be concerned that maybe you have a higher risk of this. And then toward the end, we'll also talk about what questions to ask your eye doctor if you are either taking these medications right now or you are considering going on a GLP-1 in the future. So first, a lot of people are taking these GLP-1 medications. It's estimated that about 12% of the US population is either currently taking or has at least tried one of these drugs, mostly for diabetes, but also a lot of people are using it for weight loss, as these GLP-1s not only help with your blood sugar control, but also suppress appetite quite a bit. And there's a lot of research showing improvements for cardiovascular risk with these meds, not only just directly from the med, but also because of reduced obesity. And as people shed the pounds, we also tend to see a reduction in other metabolic disease. So not only are a lot of people taking this medication, but it's also a very powerful med. And with powerful meds, we need to be observant and careful about side effects, especially ones with such grave side effects such as vision loss and blindness. Now, the most serious side effect of taking these GLP-1s that's been reported is the development of an NAION, or a non-arteritic anterior ischemic optic neuropathy, which is basically a long way of saying that the blood flow to the optic nerve has been reduced or blocked, essentially causing a stroke within the optic nerve. Symptoms of an NAION usually include sudden, painless vision loss that affects often one eye, but it usually is altitudinal. That means that the lower half of your vision just disappears or the upper half of your vision goes away. Sometimes people may even notice a color vision loss or a desaturation called dyschromatopsia, where one eye, the color vision will just suddenly seem more desaturated than the other. But the hard reality of this type of vision loss is that it's usually permanent. Sometimes there can be a subtle improvement that we see within the first month or two afterward, but most cases, the vision loss is permanent. It's not coming back. So with this, I think the logical next question is, what is the risk? If you start taking a GLP-1 drug, what is your likelihood of getting this serious side effect? Well, several observational studies have been published, and some have even estimated that you have about a twofold risk of getting one of these eye strokes. But, of course, the absolute risk of getting one of these is very, very low. It's considered quite rare, only about 1 in 10,000 cases, and that means if you're taking a GLP-1, you have about a 2 in 10,000 cases chance per year. However, I'll just add that, the criticism is that a lot of people who are taking GLP-1s already have an increased risk of having this type of eye stroke to begin with, because they have diabetes, they have high blood pressure, high cholesterol, other factors. And while yes, the risk may be low, again, the consequences are very real. In fact, back in 2024, when the first observational studies reporting this side effect were coming out, we did have several people in the comments say that they had this exact thing. They had a stroke within the eye from taking GLP-1s, and it just breaks my heart. So if you yourself have already had this and you're just trying to learn more, my heart goes out to you. I'm sorry that this happened. And I'll just add that I hope that your doctors are not only helping you maximize the usable vision you have left, but perhaps they've referred you to a low vision specialist who is helping rehab kind of how you use your vision and still functionally live your best life. I don't think eye doctors talk about that enough, but that is another component or aspect to the profession and how we can help people. And if you haven't had access to any resources like that, I'll try to include some in the show notes below. Now, there are a few other risk factors I think are really important to know about for this risk of developing this type of eye stroke. However, I do want to just quickly mention a few other interesting findings that have linked GLP-1 to causing eye issues. First of which is that they've reported in the SUSTAIN-6 trial that people who go on GLP-1s, if they have bleeding in the back of the eye from diabetes, they have diabetic retinopathy, their risk of worsening bleeding goes up. So if you're somebody who is diabetic and you recently got put on a GLP-1 or you're thinking about it and you know you already have some level of retinopathy inside the eye, then it's really good to follow up with your eye doctor so they can make sure that's not getting worse and that it doesn't need additional treatment. Also, there's another small study reporting that people who are diabetic and at risk of macular degeneration, their risk of neovascular macular degeneration also goes up. But again, very low absolute risk. And of course, as always, to prove that I'm not making this stuff up, I'll include research notes, all the publication and resources in the show notes for you if you want to read into it yourself. I know we flash these publications here on screen, but I found out a lot of people just listen to the show and they don't always necessarily watch the video part here on YouTube. So I like to call out that, again, research is in the show notes. And if you're heading that way, hit that like and subscribe button down below too, because that does help the channel out and helps this video reach more people to help people save their vision. So thank you for all your support and help. Okay, so who is most at risk of getting this NAION from the use of GLP-1s? Well, the American Optometric Association, they have an evidence-based optometry committee that basically look at all of the information that's been published, and then they reported a clinical report that did a really good summary of who's most at risk. People who have a higher risk are those over the age of 50 who happen to have diabetes, high blood pressure, or hyperlipidemia. In addition to this, people who have obstructive sleep apnea may be at higher risk, and people who have a small optic nerve, or what we call a disc at risk. Essentially, some people have larger optic nerves and some people have smaller ones. If you have a larger optic nerve, that means it's less congested and blood flow may be able to get through the nerve more readily, versus somebody with a small congested nerve, then their blood vessels may be more constricted. There may also be a higher risk for people who happen to have optic nerve head drusen, which is another condition, but this is where calcium deposits build up in the nerve, and again, that'll help kind of make the nerve congested. But either way, to know if you have a small optic nerve or something like optic nerve head drusen that may increase your risk of getting this, make sure to see your eye doctor. They'll use an instrument like this called a slit lamp, and they'll examine the optic nerve and let you know if yours is smaller and at risk. Now, if you happen to be taking a GLP-1 or you're considering it, just know that it is now recommended to have a baseline in-person comprehensive dilated eye exam either before starting it or within 1 month of starting these meds. And don't be surprised if doctors recommend following up at least every 12 to 18 months just to have a closer watch. But of course, if you notice any vision changes, to definitely call your doctor right away. Now with this video, I'll add that I am in no way telling you to either stop these medications without talking first to your prescribing doctor, or to avoid taking these medications, because we know that not only can they help quite a bit with diabetes and weight loss, but there's also some cardiometabolic protective effects from them too. But from an eye care standpoint, I think it's just important to understand that there is this risk and there's certain symptoms to be aware of, and some people who are at increased vulnerability, and to follow up with your eye doctor and just make sure everything's okay. And if you don't have a regular eye doctor and you live here in the US, I will at least put a doctor locator in the show notes so you can reconnect and find a doctor near you. But with this video, I hope that you found it not only educational and interesting, but from here, I hope you have a fantastic day. Thanks for watching. Keep an eye on it, and we'll see you in the next one. Peace.